Declaration of death. Verbalize consideration for scene safety and the possibility of the scene being a crime scene. Step 2. If no obvious signs of life are present on arrival, assess for decapitation or mortal disfigurement, rigor mortis, putrefaction, or post-mortem lividity. If any of the above are present, death may be declared without further examination or disturbance of the scene. Step 3. When medical interventions have been initiated, verbalize that, if in doubt, a consultation with ECP or MO on a recorded line is needed. If not in doubt, the following tests should be conducted during active interventions, preferably by 2 impartial providers. Allow at least 5 minutes after the last medication administration, while continuing with basic interventions such as CPR. Assess for a gag reflex by manipulating any airway that is in situ or using a tongue depressor across the base of the tongue under direct visualization. Assess for corneal reflex using gauze or cotton wool. Pull down the lower eyelid if needed and touch the cornea of the eye while observing the upper eyelid for movement. Repeat on the opposite eye. Assess for pupil response bilaterally using a pupil torch. Assess for oculocephalic reflex by keeping the patient's eyes open and rapidly turning the head 30 degrees to each side while observing the eyes for any delay in movement. If all tests are negative for life, then proceed to the next step. Step 4. Stop active interventions, and conduct the following tests. Ensure that all ECG leads are firmly attached to the patient's bare skin. The cables are connected to the monitor and the gain size is maximal. Assess for evidence of cardiac electrical activity for 30 seconds or more in all 3 leads. Palpate central pulses. Confirm absence of central pulses. Auscultate for heart sounds at the apex of the heart and the left parasternal area. Disconnect any ventilation devices and assess for any respiratory movement, including gasping, for 5 minutes. If all of the above tests are negative, then the student may withdraw resuscitation efforts and declare the patient dead. Note the time. On declaration of a patient, ensure that all documentation is complete and the patient will then be handed over to either the South African Police Service or a suitable person once arrangements have been made for removal of the deceased.